All right, Mr. Gauen, I'm going to ask you to take about 5 steps forward so I can observe your gait. And what I'm seeing is a smooth and balanced gait. It's even. All right, and if we can step over this way, I'm going to look at some other things about your posture. All right, you are standing erect and you look symmetrical. And your extremities appear to be similar in how they are shaped in their size and their contour. And I'm seeing that your head is aligned over your gluteal fold. And then if I look at each of your shoulders, shoulder blades, iliac crest, and gluteal folds, you're aligned horizontally this way. And you're aligned vertically because I see that your head is over your hips, over your feet. Would you turn to the side, please? Take a step forward. I'm not sure if you're still in. Oh, come towards me.
Yeah.
Oh, okay. And I'm seeing a curvature here at the cervical spine and the thoracic spine, and that's what I would expect to see. I'm sorry, so your cervical spine and your lumbar spine, and that is what I would expect to see. And then as we get ready to do range of motion, I'll be looking at each of the areas, and I'll check your skin color. I'll look for swelling and masses. And also when I examine the muscles themselves, we're going to look at the size of the muscles and the symmetry, and if there's any kind of twitching or spasms present. And just in a quick overview at this time, I'm not seeing any of that right now. Okay, thank you, Mr. Gauen. I wanted to expand a little bit to talk about some of the things that we can find that can be considered a deformity looking at your joints and muscles. But one would be a dislocation between two bones in a joint, and that's called a dislocation. Another would be a subluxation, and that's when two bones in a joint stay in contact but they're no longer correctly aligned. There's also a deformity called a contracture, where the muscle is shortened and it does not allow your joint to move fully, so we call that range of motion. So you'd have limited range of motion at that joint if you had a contracture. And then there's another one called ankylosis, and that's when you have severe stiffening or possibly the fixation of a joint, so the joint no longer moves fully. So with each area, I will palpate the joint, and I'm going to look for warmth and tenderness, and that can tell me that there's inflammation in the joint. And I'm also going to try to see if there's fluid that I can feel in your encapsulated joints, synovial joints, and that actually would be considered possibly a problem, because we don't typically, if we can move the fluid around and we have a fluid shift or we see bulging, then that can be indicative of a concern. So those are things that I'm going to be checking for. Additionally, if it feels like I said boggy or soggy, that would indicate that the amount of the fluid is excessive. So we want there to be fluid in the joint, but typically we're not going to be able to feel it. When I'm feeling your muscles, I want your muscles to be firm and also to be free from heat, swelling, and tenderness, or also in a joint I could hear crepitus, which is when there's the bone-to-bone contact. But when I'm doing range of motion, I'm going to see hopefully that you do not have these things, that you do not have crepitus or the bone-on-bone kind of a cracking sound, that you don't have any tenderness, any spasticity, or any joint instability. So those are the things we're looking for. So we're going to start with your joint here, your mandibular joint, and I want you to open your mouth as much as you can. Okay, so that's a normal amount. You're supposed to have the ability to open your mouth 3 to 6 centimeters, and that can tell me about the length of 3 fingers. And then I'd like you to open your mouth again and close, open, close. Okay, and I'm not feeling any kind of clicking or noise, so that would be considered normal. Now with your mouth partially open, I'd like you to move your jaw from left to right. All right, looks good. You should be able to do that about 2 centimeters, and you have completed that. I'm going to ask you to show me all the ways that you can move your head. So let's start by having you move your left ear to your left shoulder, and left ear or right ear to your shoulder, and that should be about 40 degrees. It looks like you're able to do that. Okay, and now I'd like you to turn your head from left to right. Look over your shoulder. Okay, and now I'm going to put my hand here and I want you to push against it. Okay, good. There's good resistance. And you're supposed to have about a 70-degree rotation on that, and you were able to demonstrate that as well. And then can you put your chin to your chest? And then can you stretch your neck back? Okay, that also looks great. All right, I had asked you before to put your chin to chest. I'm going to ask you to do that again, and I'm going to check from the side, okay? And that looks about 45 degrees. And then extend your neck backwards. And that also looks to be about 45 degrees, and that's what I would expect. I need to also ask you to push your chin forward like an underbite, and then pull it, retract it, and pull it underneath. Okay, and you did both of those, and that's what we're hoping that you should be able to do. I'm going to come around to the other side. You can stay right where you are. And I just want to see you from the side, and I'm looking at that your head is erect, and then in the back I'm able to see that there is no folds, or that the way that the skin is here is the same on both sides. So you'd have symmetrical skin folds, although you have none. And then I'm going to palpate along your the center of your neck, and that seems normal. Do you mind turning just a little bit towards me so I can reach your back? Towards this way. That's great. Okay, thank you. Mm-hmm. So I'm palpating the cervical spine. Okay. And the trapezius. And then can you turn your head towards the right so I can feel along these muscles, and then turn the other way. All right, that's great, thank you. I think the other thing, have you brought your ear to your, okay, all right, we're good. So, okay, I'm going to ask you to put your chin to your chest. I know we did this earlier, but I'm going to ask you to do it again. Okay, and I'm noting a 45-degree angle, and then extend your neck back. And I'm again noting a 45-degree angle. Thank you. Mm-hmm. And now I'm going to assess the sternoclavicular joint. And I'm moving around to the back, around the scapula. And I'm making sure that there's no pain. So if you felt pain, you need to tell me. Okay. We did some movements earlier, and now I want you to do the same movements with resistance. So I'm going to put my hand on your forehead, and I want you to put your chin to your chest. All right, and that not only helps me assess your sternomastoid muscle, but also your 11th cranial nerve. I'm going to put my hand here, and I'd like you to turn and look over your left shoulder. Okay, so you can move against resistance, and the same over here. Terrific, thank you. Mm-hmm. So now I'm going to examine your back, and I'm going to start by kind of palpating along the spine on either side of the vertebral column. All the way down to the iliac crest, the scapula. Okay, and now I'm going to percuss down the vertebral column. And on the sides. Okay. Okay, Mr. Gauen, I'm going to ask you to bend forward and touch your toes. And I'm noticing that you're in the range of the 75 to 90 degree flexion. That's great. And if you stand back up, and I want you to bend backwards or hyperextend your back. Looks good. That's at least 30 degrees. And I'd like you to turn and rotate from left to right, like from your waist. Okay, great. That's it. They expect it in the other direction as well. All right, terrific, and that's at the expected amount, which would be about 35 degrees. Okay, Mr. Gauen, I'm gonna have you touch your toes again, and I noticed that you had a 90-degree bend. All right, and I'm noticing that there's symmetry on both sides up the spine, and now if you'd rise up slowly, please, and stay. And I'm noticing that the back went from being concave back to convex as expected. All right, Mr. Gauen, would you turn and face me, please, and put your hands on your hips. And I'd like you just to twist side to side. Very good, and that's about 30 degrees as expected. And now if you would just lean to one side, so let's say your left, you can drop your hands, lean to one side, and then stand up, and then lean to the other side. All right, stand up. Let's lean to this side again one more time. Okay, looks great. About 35 degrees is what we would expect, so you've met that mark. All right, Mr. Gauen, I'm gonna look at your shoulders again here, and I'm noting that they are even and symmetrical. And we had felt some of the joints here along the sternoclavicular area. I'm going to ask you to demonstrate flexion. You do have a light above your head, so be careful. But if you would just extend your arms straight in front of you and raise them up over your head as high as you can. Okay, and that is meeting the expectation of 180 degrees. You can lower them now. And if you bring them behind you, can you show me how much you can flex them back? Okay, wow, that's more than you'd expect. You'd expect about 50 degrees, but you have some flexibility there in your range of motion. Okay, so we're going to do adduction. You start at the side, and and you're going to go up over your head. Again, sorry about the light.
No, it's okay.
Okay. Does this one move? There we go. Okay, so that's 180 degrees, which is what we'd expect. You can bring them back down. No pain?
No.
All right, and now for adduction, just take your left arm and bring it across your body. Okay, we're expecting that at 50 degrees, and show me that also with your right arm. All right, very good. All right, I'm going to ask you to bring your arms and put them behind your back, and you can meet your hands like this in the back, just like that. Very good. Okay, and that looks like 90 degrees. And then again, be careful of this, but you're going to put it behind your head like you're laying down watching television. All right, and they're even. All right, great. And that should also be 90 degrees.
And relax. I need to check the strength in your shoulders. Can you shrug your shoulders?
Now I'm going to provide some resistance. I'd like you to shrug your shoulders. I'm going to try to push it down. You're going to try, just keep, okay, I want you to shrug your shoulders and hold it.
Okay.
And I'm going to try to push them down. Okay, and you're not able to do that, so that's good. Put your arms straight out at the side, and I'm going to try to press your arms down, so you want to try to resist that. Okay, very good. So in addition to testing muscle strength, that also is another way to assess the cranial nerve 11. All right, Mr. Gauen, we're going to do an assessment. It's called the NEARS test, and this would help us evaluate if there's any damage internally to your arm or particularly your rotator cuff. So I'm going to ask you to put your hands at your side, and I'm going to make sure that your arm is pronated, and I'm going to lift it up, and you're going to let me do the work here. So you're just going to report to me if you feel any pain. If you had pain, that would be a positive test that could indicate a problem with your rotator cuff. And did you have any pain?
No, that's fine.
Okay, great. All right, we are now going to do something called the Hawkins test. And again, you're going to let me do the work, and I'm going to bring your arm actually up like this, and then I'm going to rotate it inward, and I'm going to ask if you have any pain.
No.
Okay, so if you did have pain, that could be a problem again with your rotator cuff or your brachial tendon. And typically if you had pain, you'd feel it at the end of the range of motion, like when your arm is extended upward the most. And I would repeat this on each side, or whatever side you potentially had a problem with, if we were evaluating for that. All right, this next test you're going to do, and this is called the drop arm sign, and I'd like you to extend your arms all the way up over your head, and then bring it down to be parallel with your shoulders, and then just rest it there for a minute. Okay, and now you can bring it the rest of the way down. And if you had a drop arm, you would not be able to hold it here at the sides. You wouldn't have the ability, so that would be maybe a nerve impingement or some problem with the muscle group in the rotator cuffs area. All right, the next test we're going to perform is called the empty can test, and I'm going to ask you to bring this arm up, and I want you to bring it towards you, abduct it towards the body, like you're pouring out a can. And this actually, you can relax your shoulder a little bit. Just need the line to be at shoulder height. I'm going to put one hand here to support the shoulder, and I'm going to push down, and you're trying not to let me do that. So pushing down, and you are able to, you have strength to resist me, so you can rest your arm. And that, if there was a positive sign, you would have pain, and that could indicate a torn tendon or an impingement of a nerve or some other damage to the shoulder region. All right, so next we're going to do a forearm supination, and we're going to have you make a sign here that holds your arm up like this, and then I'm going to press against your hand, and you're going to not allow me to push your arm back.
You're supposed to push your hand behind it's behind.
Oh, okay.
Yeah.
Let's do it again.
Okay.
I better watch that again.
The first one is actually called the internal rotation resisted strength test. I'm going to have Melissa go ahead and bring her shoulder into 90 degrees, her elbow into 90 degrees of flexion, and her wrist is going to be in neutral. I'm going to brace her elbow a little bit here.
Brace your elbow.
I'm going to go ahead and put my hand behind her hand and have her press.
If you want to know how to stretch your spinatus and teres minor, in this video I'm going to show you 8 easy ways to do it, and the last way is going to blow your mind.
These are all the trainers in the world.
This is Brennan the Brooklyn student. In this video we're going to go over 2.
Okay.
Go on. Let me just, all that was recorded for some reason.
Okay, we are going to now check your forearm supination, and I need you to put your arm in a like a L-shaped angle, and I'm going to try to push your arm forward. So I need you to apply resistance. So I'm supporting your elbow and pushing forward, and you're able to resist that. So that's a good thing. If you had pain or you didn't have strength, then that would be a positive sign, and that could be indicative of a problem in your shoulder. All right, Mr. Gauen, we're going to do the same test again, only this time when I'm supporting your elbow, I'm going to try to push your hand backwards, and you're going to be pushing forward. All right, so I'm applying pressure, and you're matching my strength, and I would note that you had the same strength whether I was pushing your arm backwards or whether I was pushing your arm forwards, so there's no problem with your shoulder. All right, and now we're going to evaluate your infraspinatus strength, and I'd like you to bend your elbow and kind of keep it in this position, and I'm going to support your elbow here a little bit, and I'm going to try to press inward, and you're pressing against me, and this is evaluating the infraspinatus muscle, and this would help me know if there's any kind of a tear or a tendon tear or a nerve impingement or any other damage to the rotator cuff. But without pain and with continuing to have strength, we don't have a concern for you at this time. All right, we're going to look at your elbow. Again, I'm just doing one side for the video, but you would examine both sides of the elbow in an exam. And the first thing I'm going to do is just inspect the elbow. I'd like you just to hang your arm next to you and kind of put them out to the sides. Okay, so I'm seeing the angle between the humerus and the radius here is about 15 degrees, and that's what I would expect. And then I'm actually going to look at the elbow itself, and I'm going to palpate here to see if I can feel any nodules. And I'll go over, I'm not finding any masses or nodules. And then I'm also feeling the actual part of the elbow here, above and below, and on either side. And I don't feel any masses, no tenderness. All right, great. So I'm going to ask you to bend your elbows and then straighten them. And if you could leave your hands open. Try that again. All right, terrific. So I'm seeing a normal, can you bring them down to your sides? Okay, let's do that one more time. Up and then down. All right, terrific. So we're seeing about 160 degrees, and that would be the normal flexion and extension for your elbows. And then the other thing is about bringing them, okay, if you could rest your arms at your sides, and I'd like you just to bend up your elbows, okay, and then you can keep your hands straight, and then just flex them all the way down, relax all the way down. All right, so I was seeing a rotation of 160 degrees when you flexed and 180 degrees when you extended, and that would be within what we would expect as a normal finding. All right, I'd like you to place your arms out in front of you, like, well, it may be more like you're carrying a tray, a little bit lower. And I'd like you to turn them downward. We call that pronation. And then can you turn them back up? Good, and that's supination, and that's showing a 90-degree rotation, and that is what the norm would be, so that's what we would expect. And so now I'd like to test your elbow strength. If you would kind of reach up to try to touch your shoulders, and don't let me bend your elbow or extend it to apply resistance. All right, terrific. And we're going to do the reverse of that. So if you would relax your elbow a little bit, and now I'm going to resist you bending it up. Okay, good. Any pain?
No.
All right, terrific.
Wide. And bend your elbows as far as they can go.
Expect flexion of 160 degrees.
And straighten.
Expect full extension.
Okay, now bring your elbow back up, straighten it, but don't let me bend it. I'm going to try to push up and, okay, so you've got great strength there. You're not letting me bend it. Very good, thank you. Okay, place your hands out for me. I'm inspecting the hands for their continuity and color. I'm counting the digits on the hands and the thumbs, and they're all complete. I'm also going to feel each of the bones in the wrist for any warmth, tenderness, or swelling. Any warmth, tenderness, swelling? Any numbness when I'm pressing on it? Okay. I'd like you to bend your hands down. This is metacarpal phalangeal flexion, and it's 90 degrees, and that's what I would expect. And you can extend it. And if you'd have your hands now and bend them upwards, okay, great. That's supposed to be at least 30 degrees, and you're meeting that, so that's a normal expected finding. Thank you. Okay, next I'm going to ask you to touch your thumb to each of your fingers, but at the very small finger here, just to the base. Okay, and on the other hand? Very good. Can you make a fist? Both hands. Okay, thank you. Next, I'm going to ask you to spread all your fingers apart and bring them back together. There you go, and just bring it back together. Very good. Thank you. All right, and now with your hands in front of you, I'd like you to bring them towards each other without putting your elbows out, just bending your wrist. There you go, and bringing them out the other way. All right, great. Thank you. All right, so bring them together. And that's about 20 degrees. And then out is over 50 degrees. That looks very good. Thank you. The next test we're going to do is something you have personal experience with. It's not a problem at this time, but we're going to do the Finkelstein test. And this allows us to look for de Quervain's tenosynovitis. But the way that we test for that is that you bring your thumb into the palm of your hand, and then you wrap your fingers around it and place your arm in this position. And then I'm going to ask you to bend your arm downward, and I'm going to put some pressure here along the side. And if you have pain, then that is indicative of inflammation of this area here, this tendon. So do you have any pain at this time? No. Have you had that pain before?
Yes,
Pretty painful?
definitely.
Okay, I'm glad it's resolved, so that's good. But at this time, you have a negative finding, which is good. Okay, so now I'm going to demonstrate how we would palpate the anatomical snuff box, which is kind of a depression right in this area. And if you have pain, then that would be indicative of a scaphoid fracture, which is the most common fracture to have in the wrist. And so if I put pressure right here, are you feeling any pain?
No.
All right, terrific. Thank you. All right, I'm going to just check the strength of your hands. So I would like you to squeeze my hands, and I'm going to try to pull away, and you're not allowing me to do that, so that's great. And that lets me know that your thumb and your fingers are strong, and we'll do the same thing here. Okay, don't pull them away. Very good. Thank you. So I'd like to inspect each of your hands, and I'm going to feel across the joints here for any tenderness or swelling. And are you experiencing any tenderness or swelling?
No, I'm not.
All right. So I might have a finding that is tender if you had a problem maybe like rheumatoid or osteoarthritis. I might note some changes there. All right. All right, if you would bring your hands up, and I'm going to ask you to kind of show me if you can wave. So bring them out, both out and back in. Okay, so when you bring them out, they're like at 50, 55 degrees, which is normal. And when you bring them inwards, I'm seeing about a 20-degree, so that angle, and so that's good. And then you open all your fingers for me and close them. Open, close them. Can you make a fist? And can you bring your thumb across your palms? All right, bring your fingers together. Looks good, thank you. Okay, I'm going to ask you to bring your hands together like this. All right, you don't have to put them up by your chin. There you go. All right, do you have any pain or sensitivity?
No.
Okay, that's Phelan's test, and that can help us identify if you have any problems with carpal tunnel. Another thing that I can do if you relax your hands is I can put some pressure here, and I'm actually trying to palpate the percuss the median nerve. And does that cause any tingling or numbness in your hand?
No.
But this hand.
No.
Okay, and that would be the Tinel test, and so that's also negative for you. So good for you. No carpal tunnel. Thanks. All right, Mr. Gauen. Next, we're going to evaluate your hips, and one of the things I could do is identify and feel the top of both of the hips here. Oh, yep, got them. And you have any pain or tenderness?
No.
All right, terrific. I'm just going to ask you, without bending your knee, and I guess we have a light here,
We'll be fine.
that you're going to lift your leg up as high as you can. Terrific. Okay, put it down, and you can do that with the other leg. And I'm seeing that you can elevate your legs 90 degrees, and that is something that I would expect, so that's good. Can you carefully roll onto your abdomen? All right, very good. And now you're going to lift up your legs again as high as you can, one at a time. All right, that's great. And the other side, terrific. And I'm seeing at least 30 degrees, and that's what we would expect as a normal finding. Okay, so now we're going to have you bend your knee and bring it up to your chest one side, and then the other side, doing the same thing. And I'm seeing a 120 degree angle, so that's a good, that's what we would expect to find. I forgot to say out loud that when you bent your knee, we were looking at your hip flexion. So now we're going to look at abduction and adduction. So if you would start with your right leg and just bring it, you're going to leave it to this level and just swing it out from your body. Very good, about 45 degrees is what we'd expect. And now I'd like you to take this leg and cross it over your other leg. Okay, you want to try to keep your hip on the table here. There you go. All right, good. So I'm seeing abduction and adduction about 45 degrees with one leg. And then when you cross over with the adduction, I'm seeing about 30 degrees. Can you repeat it with your left leg? Okay, terrific. And then cross over carefully. I know you're trying to avoid the lamp, but yeah, so I think you'd have 30 degrees there as well. All right, thank you. Okay, I'm going to have you bend your right knee and put your foot on the table. Put your foot flat here on the table, and you're going to be bending your knee in. Okay, so that's internal rotation, and we're hoping to see about 40 degrees, which I think you achieved. You can extend that leg, and please bend this leg and turn it in. Okay, internal rotation again seems to meet the requirement of 40 degrees. All right, now we're going to look at external rotation, and you do that by crossing this leg over your knee, like if you're sitting in a chair and you're crossing your legs. Very good. And relaxing your knee. And we'd hope to see at least 45 degrees rotation and you've got more than that, you're doing fine. You can switch and do it with the other leg, please. All right, very good. Also seeing an external rotation of 45 degrees or greater. Okay, so I'm going to check resistance in your leg. Do you mind bending your knee and putting your foot on the table? I'm just going to do it on one side, and I'm going to try to push your knee down, but you're giving me resistance, so that's great. You've got good strength there. Go ahead and extend your leg, and I want you to try to, I'm going to ask you to push up against me. Okay, very good. So you have good strength in your legs. Okay, so I'm going to ask you to try to resist me bending your leg. So I'm pushing up, trying to bend your leg, and you're not allowing that to happen. So very good. Thank you. All right. Go ahead and swing this leg out.
Out where?
This
Oh,
way? Yep.
Okay.
And I want you to resist me pushing it back in. All right, so you've got good muscle strength for abduction. And now I want you to cross the leg, a straight leg over here. And I'm going to try to pull it back, and I want you to resist. Don't let them touch, just elevate that leg. Yes, and I'm trying to pull it back over. Okay, and you have good abduction and adduction strength. Thank you, Mr. Gauen. All right, I'm going to examine your knees next, and this can be done with you squatting down, but that would be harder to film. And so we're going to have you bend your knee here on the table. And I'm examining the structure of the knee, and I'm not seeing any bulging or abnormalities with the knee, so it looks normal. And I'm going to palpate the top of the bones here, and then even into the back of the popliteal space for any crepitus or pain or swelling or warmth, and I'm not seeing any. And then on the other leg, same thing. The knee looks normal in its size and shape, and it's smooth across the bones here, and there is no warmth or swelling, and no crepitus, no masses. All right, no redness. All right, you can bend those back, lay them flat, and also examining the knees at this time. They're looking symmetrical, with no tenderness, no masses, no bulging. Is that correct?
That's great.
All right, so now I'm going to do a battlements test, and I'm just going to do it on this leg, but I'm going to put pressure on the suprapatellar pouch, and I'm trying to push down here to maybe shift the fluid and see if there's any bulging or tenderness, and I'm not seeing any change in the knee, so I think that the battlement test is negative. All right, next we're going to do the McMurray's test. I'm trying not to stand in the way. Let's see if I move the camera a little bit here. And the patient is laying down or in supine position, and this is to see if there's a tear on the medial or lateral meniscus. And so the leg is bent, and I'm going to support up here, and then I'm going to internally rotate. Can you bend your knee a little bit for me? There we go. And I'm going to internally rotate the knee. And do you have any pain?
No.
Okay, and then externally rotate it and pull the leg out. Any pain?
No.
Okay. So I would be listening for like crepitus or any pain or popping sounds that could indicate that there's damage to that area. Okay, let's see if I stand here. Am I in the view? Okay, great. So now we're going to do the anterior drawer test, and if you would bend your leg for me and rest your foot here, I'm going to put pressure behind the knee, and I'm going to kind of push into the kneecap and pull forward.
Okay.
And I'm going to see if there's any pain or movement.
No.
Okay, so that would indicate that you do not have a problem with your ACL.
Okay.
Okay, so now we're gonna do the Lockman's test, and actually I need you to relax your leg. It's just supposed to be in about a 30-degree angle, and I'm going to have one hand on, go ahead and keep your foot turned, there we go. I'm gonna have one hand up here on the femur and the other on the tibia, and I'm going to have about a 30-degree turn here, and I'm putting some stress, and I'm looking to see if there's any movement in the patella area or displacement. And if there was, then that could indicate an ACL tear, but I did not see any movement, so that would be negative. Also the MCL tear. Is that in the picture? My paper?
No.
Okay,
Well, it is when you do that.
one here.
Holding it. Oh, it's your blouse. I mean, it's right there.
Are we rolling?
Yeah.
Okay. Now we're going to do the valgus test, and you're in the supine position, and I'm going to ask you to like rest your leg just off the edge of the table here,
Okay.
just a little bit, and I'm going to stabilize the femur and put the other hand on the medial ankle, and this is going to help me test for a medial cruciate ligament tear. So stabilizing the femur and kind of pushing outward here, laterally on the ankle. Any pain?
Nope.
Okay, and there's no sensitivity of the ligament here, so that is a positive, or not a positive, it's a negative sign, which is a good thing. All right. All right, and so now we're going to look at the posterior drawer sign, and you're going to have your knee bent about 80 degrees, and your hip at about a 45-degree angle. And then I'm going to be feeling behind here for your tibia, and I'm going to put pressure on either side and see if you note any kind of pain.
Nope.
Okay, so then this would be checking for your posterior cruciate ligament or a PCL tear. Okay, thank you. Thank you, Mr. Gauen. Okay, so we're gonna look at the knees one more time, and I'm gonna ask you to show me internal rotation. So I'm gonna ask you to swing your lower leg. Start with this leg towards the midline. So
Just swing it like this.
um,
Or like this. Across my leg.
well,
No.
that's a good thing to be able to do too. But no, right now, I just want you to have them extended and then just cross it over. There you go, and then bring it out to the side. I think you're gonna need to, see if I can demonstrate it for you. There you go. Okay, great. And then the other leg. Terrific. All right. And then if you could stand up. I don't know if you'll be visible on the camera. Turn it down a little bit. Perfect. Okay, can you show me, you're gonna want to turn to the side here so I can see, and you're gonna bring bend your knee back as far as you can.
Bend my knee
Just
back.
at your knee. Very good. Okay.
Like that?
Yep.
Okay.
So we're looking for it to be at about 130 degrees. Can you do that one more time? And then also on the other leg. And then can you bend it forward? No, lift
Like
it
this?
forward.
Oh, okay. Yeah.
There you go. Okay, lift it forward, and you want it to be about 30 degrees. Okay, not your whole leg though, just like kind of for the lower leg. Just the lower leg. There you go. Yes, and same on the other one. Terrific. Okay, thank you very much. Okay, so now I'm going to examine your feet, and I'm going to do a little palpating. I'm going to feel in the back here, and I'm feeling where the Achilles is attached, and then I'm feeling both of your ankle bones or your malleal, I think I said the wrong word, metacondyle bones. And I'm feeling for redness, warmth, pain, swelling. Just feeling across the feet as a whole, and then feeling each individual joint. And I could be able to examine if there's any problems with tenderness, redness, bunions. All looks normal. Terrific. All right, so now I'm going to ask you to point your toes up to the ceiling and flex your feet. And that looks great. That's dorsiflexion, and it looks like it's meeting the expectation of 20 degrees. And now point your feet downward, and that would be plantar flexion, and that is about 45 degrees, which is what we were expecting. And now can you bring your feet towards each other? So at inversion, you've got at least 30 degrees, and then push them away, and then that's your eversion is about 20 degrees, although you're a little more flexible than that. So you are meeting all the expectations and norms for the range of motion for your feet and ankles. You bend your toes for me, squeeze them down, like make a fist with your toes, point them upwards. All right, terrific.